So, we are with Dr. Mrs. Linda Vanotoo, Regional Director for Health Services in the Western Region. Madam, welcome again to Africa Next.
Thank you very much.
I say welcome again because those of you who watch Africa Next TV, you might recall that Madam was with us at our small conference on public health in Sekindi about 3-4 weeks ago. Now I'm here to talk. We are talking to you here in Accra, specifically out of one of the points you made on the Africa Next conference, which is that the regional directorate, you'll be holding a conference on maternal and child health.
Yes, that's right.
Did I get the title of the
Maternal,
conference?
newborn, and child care conference.
Maternal, newborn, and child care conference. Okay. Can you tell us something about the conference?
Yes, thank you very much. This conference is coming on between the 18th and the 20th of March 2009. And the main focus is to draw attention to something that probably has been neglected for quite a long time. And that is the issue about newborn care. If you look through our records, you find that for the Western region, over the past 3 years, every year, in addition to the live deliveries that we record, in terms of women who have been pregnant and gone to our various health facilities to deliver, we have the stillbirths, or the babies who are born still.
You mean babies who are born dead, not ordinary language?
Born dead. And we have about 1,200 every year.
In the Western region alone?
In the Western region alone. And this is a very, very big issue. Unfortunately for us, it looks like we are not doing much in terms of looking at why these babies are dying and then addressing those issues to be able to reduce these numbers. In addition to this, we also have those who deliver and the mothers themselves pass away. If you look through our records again, we have about 100 per year for these women who die. Now, if you link this up to the Millennium Development Goals and what is being done, we realize that a lot is being done for child survival and for maternal survival. However, most of these have been in the post-neonatal period, which means that it's mainly after the 28 days of a baby's life. Now, looking again at the records from the WHO, that's the World Health Organization, and from various countries, you realize that a lot of babies die, either they are born dead, or on the first day of delivery they die, or within the first week, or within the first month. And these are the gaps that we identify in our system. For example, as a region, it will be very difficult for us to know how many babies who were not born in the health facilities were born dead. How many of them die in the first day? How many of them die in the first week? Even for those who were delivered in the health facilities. Or even how many of them die after 28 days? One may say that we have what you call the postnatal care services. But this is at the will of the mother or the family. If a woman goes home and she decides that she will not go for the postnatal care, for now, it will be very difficult for us to know
what system do you have for us to tracking women who came for your prenatal care, have delivered in hospitals? Do you have any systems for tracking where they are and so on?
Well, not exactly. Before they go home, they are counseled as to the importance of the postnatal care. It is a time that we examine the mother, we examine the baby, and we address any problems that she might have. And we wish that this will be done before the first 10 days are over. Now, as to whether we have a system where we can follow them up to the homes, it is not very well established. In some smaller communities, we can have the community health nurse or another health staff visiting the mother at home. But it is not that established where we can say that it is universal. So a lot of these babies are dying. and we may not be recording them, and therefore we may not be doing the right things to be able to reduce these deaths. The other aspect of
let's remain there for a minute. I mean, looking at this from the interest of Africanists and galvanizing knowledge through technology, do you see a role for some technological means for keeping in touch with the women who come to your health facilities? Do you take their mobile phones? Could that be some way of keeping in touch?
Well, for some health facilities, you find that some of the staff would take the phone numbers of people and probably call them. If you look at our recording forms, the old ones do not have places to record the phone numbers. However, now when people come, because they make phone calls to the families, we have an idea and then we collect the phone numbers.
The form still does not capture it.
No.
So that might be a change in the future.
We can do. Even if there's no space specifically, we can still record the phone numbers, and that I believe will be a very, very good point to follow.
Because my suspicion is that perhaps after the postnatal care, the women don't come, not necessarily because they don't want to come. I mean, being a Ghanaian, I know that if a woman delivers, for instance, she's supposed to go out to the hospital in new clothing. Maybe she doesn't have a new clothes.
Yeah, that is true, and that is one of the things we also talk about, that you don't have to come in any new clothes. Come as you wish, any way you are dressed. We are interested in knowing whether the baby is well, whether you are also well, whether you are having any difficulties that we can help you to address. But going back to the mobile phone question, I believe that from now, if we are able to record every client's phone number, and then also
you have some community
yes,
you can develop on.
And then also make sure that we have this recorded on the computer, then we'll be able to know who is due for a follow-up, and we can call to find out or to remind the person. Or even that if the person cannot come to the health facility, then that person can be linked up to a facility that is closer to where she is, and then she can be followed up by the staff who is in that area, or she can attend the health facility that is closest to her.
Well, Madam, thank you very much. On my own behalf, I can assure you I'll definitely be at the conference. In point of fact, as I said in Takoradi, we were going to have our next conference on education. We were looking at the end of the month, but as of now, I'm working very hard towards getting that conference combined with things from the health sector. Because health and education go together anyway. On the 21st of March, a day after your conference. I wish you well, and I think this is an effort that deserves all the support necessary. Thank you very much.
Thank you.
Thank you.